So here we are in part F, how to clear estrogens out of the body in the natural way. Now, this section here is color-coded with yellow, green, and red. Each of these sections is coded that way because the green is the way that we want to prefer to have estrogens removed from the body because it's good and clean. The yellow, not quite so bad, and the red, very bad because there are a lot of cancer-producing byproducts that occur as a result of estrogen being metabolized in this way. Now, too much of a good thing is bad. The same principle applies with estrogens. Thus, excessive amounts of estrogen need to be cleared from the body. We've talked about that several different times. And so there's three primary pathways of estrogen clearance. That is why we color code our chart. The green pathway is the best route for metabolism of estrogens. We call it the good route. It produces the least damaging effects on the body due to the types of estrogen that are produced. So these types of estrogen here are not as toxic and not as damaging to the body as they go out. One of the primary metabolites is 2-hydroxyestrone. Now again, estrone is E1. Estrone, E1, a type of E1. And 2-hydroxyestrone levels in the blood are thus a marker of the amount of estrogen being cleared in this fashion. So you may not know, but we actually can test the blood and see how well the body is removing estrogen and in what pathways it's removing it. Is it removing enough from the good and the bad and not very many in the ugly? Or is it primarily from the ugly? This helps to drive our treatment protocols and the way that we treat someone. We don't have to do it that way. We can assume that the body needs the support to clear it out in the good way. But if we want to get really specific, if someone really wants to know the details, we can do a blood test that actually shows the different levels of removal of estrogen from the body, whether it's the good, the bad, or the ugly, whether it's the green, the yellow, or the red route. Now, the yellow pathway is the bad route for metabolizing estrogen. What is the primary metabolite or the breakdown of estrogen there? It is 16-alpha-hydroxyestrone. And it is also the marker of the amount of estrogen being cleared in this fashion. So we will look for that in the body. We'll look for this one in the bloodstream, just as we look for this one in the bloodstream to figure out if it's being removed in the good fashion or in the yellow zone fashion. A healthy metabolism of estrogen is indicated by higher levels of 2-hydroxyestrone in the blood rather than 16-alpha-hydroxyestrone. Again, specialized blood testing of estrogens can tell us whether the preferred route of metabolism is being used predominantly or not. There is a 40% higher rate of breast cancer associated with metabolism in the yellow route. Women with a family history of breast cancer should be tested for the ratios of 2 to 16 alpha-hydroxyestrone. So this is one of the ways that we can actually screen and see if a woman has a tendency, if she's clearing out estrogens in a way that would actually suggest that we need to alter that early in order to help prevent cancer. Now, the red pathway. The red pathway is the very worst route for metabolizing estrogen. This is because it typically produces byproducts which are carcinogenic in nature. This then puts a greater load and burden on the liver's detoxification mechanism as well. This is why we call this route the ugly. Now, many of you may have heard of Premarin. Premarin is a form of estrogen which women have been prescribed for 50, 60 years for menopause. Now, it's being used less now, but Premarin is actually it's called Premarin because it's actually from horses. It's horse estrogen. It's pregnant mare's urine. That's what Premarin stands for, pregnant mare's urine. And the estrogen is removed from mares who are kept pregnant constantly in order to produce this in the drug manufacturing process. So Premarin, though, is metabolized in the red fashion. So if a woman is on HRT, it's very important for her to also take a supplement that we call estrofactors, because that is going to help drive the clearance in more of the green and the yellow zone. Now, it's very important to also have antioxidants added to the supplement regimen because of the toxic byproducts that are being produced as those estrogens are being driven out through the red zone. So there are various kinds of antioxidants that we use, and one of those may be Cell Protect, which you could also get online from our online web store, where you can get that and order it online. Now, in order to help the body preferentially use the green pathway of metabolism, we can supplement in a variety of nutrients. Now, these include I3C, estrofactors, estrobalance, and Folapro. The new and improved types of Ultrameal also contain some estrofactors which are necessary for the preferential hydroxylation and methylation via the green pathway. Now, hydroxylation and methylation, big chemical technical terms, but as we are moving estrogen out of the body, different things are attached to the estrogen to make it easier to take out through water. Estrogen is fat soluble, and so it tends to stay in the fat. And in order to get it out through urine or through the stool, we want to change it a little bit so it's easier to remove with water. Just like if we're washing dishes, we use some detergent to get rid of, to make the oily things more easily rinsed away. And so the hydroxylation and methylation are ways to kind of use a detergent to make the fatty things more water soluble so it'll go out of the body more easily. That's essentially many of the ways that the liver does it, is by essentially it's like a washing dishes with a detergent kind of process. So using the green pathway produces less toxic byproducts than the yellow or red pathways, and that's why we're talking about this in such detail, because I think it's actually very important for people to understand the reasons why we prescribe particular supplements, because this is functional medicine. This is understanding the process by which the body operates, and then utilizing that knowledge in order to improve functioning and to try to reduce risk factors for things like cancer, and whether that be prostate cancer or breast cancer, ovarian, or cervical cancer, is to improve the body's health. So now let's move on to G, section G, which is actually laboratory testing of hormone levels. We mentioned that a little bit already, but let's go into some more detail.